Hi, we're here today to talk about our bestseller Tonguepress from TheraSIP. The Tonguepress uses progressive resistance exercise to increase swallowing proficiency. Progressive resistance exercises are exercises that progressively increase as the muscles get stronger. This type of training is often used with resistance bands, free weights, and weight machines. Instead of weights and bands, Tonguepress uses water pressurized bulbs. When the bulb is pressed, an indicator rises showing the amount of effort exerted. Tonguepress provides visual feedback. It can be positioned for both anterior tongue exercise and posterior exercise. The difficulty can be increased by increasing the number of presses from 20 to 30 to reach overload. Practice sessions can also be increased per day or per week. Tonguepress design is very simple. It consists of 2 clear tubes, a red floating indicator, a pressure valve, and 2 silicone bulbs. The long tube is printed with 3 levels in which the indicator can rise, and a clear end plug to keep the indicator from going into the upper bulb. Tonguepress's 2 silicone bulbs were designed for the device. They are soft and pliable, but they also provide ample resistance when filled with water. The pressure valve can be adjusted to increase the pressure. When filling the device, the end of the pressure valve is removed. To fill the device, the end of the valve is removed and the unit is placed under running water. The bulb on the long end is compressed and released in order to inject water into the long tube. The same procedure is performed with the small tube until the unit is completely filled. It's also possible to remove the short end tube from the valve, place it under water, fill it, and then place it back onto the valve. Once the Tonguepress is filled, repetitively compress the bulbs until the indicator is correctly positioned at the bottom of the long tube. Test the unit by compressing the bulb on the short tube to see if the pressure is too strong or too weak, and adjust the valve. It is difficult for some patients to fill the unit, and it is recommended that the therapist prepare the Tonguepress prior to starting care. The development of the Tonguepress was inspired by the use of the IOP. This device is able to measure tongue strength and to provide exercise in clinic. However, there was a need to develop an inexpensive tool to supplement its use. The Tonguepress is not a replacement for the IOP. It's simply an adjunct to home programming. It allows for continued maintenance of gains after therapy discontinues. The IOP helps to show the gains that the patient makes in quantitative measurements per session. To work the anterior tongue strength, have the patient place the short end bulb on the tongue dorsum and press the bulb against the hard palate until the floating indicator elevates as high as possible. Perform this repetitively, one press after another, in order for the patient to reach overload. The patient should feel tired if the frequency and his intensity of pressing are achieved. A general recommendation of 30 presses per trial, 3 times a day is recommended. To work the posterior tongue, Have the patient place the unit into his mouth and bite down gently on the flattened part of the short end tube with his front teeth. This should place the bulb posteriorly. Once the bulb is in place, the exercises can begin. Tongue press is not a therapy in and of itself. It should be part of a clinician's tools in their treatment plans. Not all patients with swallowing problems have weakened tongues requiring the use of tongue press. The use of tongue press is possible without the IOP, but quantifying gains in strength is critical for justification of care and to encourage the patient by showing their improvement per session. Patients that benefit from the use of tongue press include patients with dysbhagia, patients with oral myofunctional disorders, patients with tongue thrust or faulty tongue positioning, patients with dysarthria, post-radiation head and neck patients as part of pharyngicize, patients with tongue weakness contributing to sleep apnea, and musicians wanting to strengthen their tongue strength for wind instruments. The tongue press should be cleaned every 2 weeks by emptying the device of its water and soaking it in a solution of bleach. It should be cleaned after each use by wiping with a disinfectant wipe or the use of Pure Green 24. The device is utilized with individual patients and should not be shared. To sanitize the silicone bulbs, submerge them in a pot of boiling water for 3 minutes. Tongue press is available in singles and in 4-packs. Tongue press is another clinician-developed and research-inspired product for the treatment of swallowing and voice from TheraSIP.